It's called telemedicine. Since the start of the coronavirus outbreak, doctors and patients are meeting less in person and more on the phone or over video. The goal is twofold: protect patients by keeping them out of emergency rooms and doctors' offices, reduce in person visits so the health system isn't overwhelmed. Dr. Edward Lee now sees more than 20 patients a day this way
And we've
in
seen that as
Sacramento,
well.
California.
But nowadays, with COVID-19, we're seeing it as a necessity. Patients are being kept safe.
The telemedicine revolution, which has been resisted by some doctors, patients, and regulators, is now becoming a reality. Advocates say doctors using video, email, and other technologies increase people's access to medical care by making visits more convenient. You can live in a rural area and consult with an expert without having to drive for hours. Skeptics say a video call shouldn't replace in person visits, where a doctor can perform diagnostic tests and get the best sense of a person's overall health. Regulators in the U.S. recently gave telemedicine a temporary boost by making it easier for healthcare providers to bill for these virtual visits and giving the green light that using Skype and other technology doesn't violate patient privacy laws. Doctors say that from afar, they can do a lot, such as monitor patients who take their own blood pressure and test their own blood sugar, for example. They weigh whether a patient's medical issue can be handled remotely or in person.
Looking at a rash, looking at a spot on an arm, that's perfect for telehealth because we have the video capabilities. Um, Feeling a bump, whether it's soft or hard, that's a little bit harder, although we can have the patients describe the consistency of something like that. Um, if I needed to do an injection, if I needed to do a minor procedure, I'm not going to be able to do that over video or a phone. And so in those situations where there are urgent needs, we would bring the patient in to see us in the office.
Hospitals use robots like these so that an expert hundreds of miles away can visit with a patient and medical staff over a course of treatment, said Dr. Kathleen Jordan with St. Francis Memorial Hospital in San Francisco.
This one we use for telestroke, which is a much more in-depth neuro exam. And in that one, we would have someone at the bedside with the patient. The neurologist is controlling the camera as well as the angle and really looking at things.
Of course, there are many situations when in person meetings are best: a cancer diagnosis, an end of life discussion.
You know, the video is quite good. We can see each other, we can look at facial expressions, and really develop that connection through there. But it's hard to substitute the ability to hold a patient's hand when talking about these type of difficult situations, to give them a hug, and to pat them on the back.
As we continue to practice social distancing, telemedicine likely will change the relationship between doctors and patients. Michelle Quinn, VOA News, Oakland, California.